I have three brief comments I'd like to make, and then I have several questions I'd like to ask all the panelists, and we may be collecting some from the audience as well. Comment number one, I very much like your point about metrics, and when we came up with that National Academy panel 27 years ago, we had essentially no data. We have almost the same amount of no data today in terms of what the feed antibiotics were doing in terms of resistance, but I would say that's only a small part of the problem. There are so many other areas. And what I'd like to know, in a perfect world, what is the return on investment for every aspect of the stewardship that we impose? What is the return on investment for cleaning up the sewers? What is the return on investment for each of the various other things infection control related? So that's point number one. Number two, in terms of improving communications, Rick Sybil from Merck Animal Health and I had the opportunity to be on the White House stewardship meeting about a year and a half ago. And there were roughly 200 of us at the meeting. They put us all in a big room together in the Treasury. We heard from the Secretary of Health, Human Services. And then they split us up into two groups. The animal group went this way, and the human group went this way. So there was an opportunity where we could have learned from each other and did not. And, you know, it just was amazing to me that we had that lost opportunity. And the last thing that we all confront in this little metaphor, if you think about extrapolating into all of our little worlds, a former colleague and friend of mine, he's still editor-in-chief of Clinical Infectious Disease, Sherry Gorbach, a leader in the field of Clostridium difficile, wrote a paper about 10 or 15 years ago, and the title of the paper was, "Is it your mother or your mother-in-law?" Some of you may know what that paper is about, but I'll briefly describe it. There are two different antibiotics you can use for Clostridium difficile back then, metronidazole, vancomycin. One of them, metronidazole, not quite as good, but it didn't have as much influence on the environment, like selecting out VRE. Vancomycin, by contrast, was better in terms of the treatment to the patient, but was worse for the environment. So is it your mother or your mother-in-law? That's going to determine, in human medicine, you know, and you can... Is it me? Maybe. Did I mention mother-in-law? It's the mother-in-law. But you know, this is a problem I think we universally face. We've got our own niche concern, and then we've got the bigger environmental concern. And how do we weigh and balance those, and then come to some sort of consensus, and then communicate that? So with that in mind, the questions that I'd like to ask the panel, the following. What is your vision for the future, and how the disparate groups can work together better? Where can we find common ground for successful collaboration? Are there any other key groups that we should bring into the discussion? And is there one overriding message that the public needs to hear that they haven't heard before? So, please, want to start?
Good job.
Me first?
Go ahead, Kat.
Okay. I think the vision for the future is that we've made progress on this issue. We've figured out a way to target using antibiotics in the most appropriate way possible. We've figured out ways to prevent the need for them. We've had incredible discoveries of new tools and resources that have reduced the need for antibiotics so that we can, in fact, preserve these important tools for the future. So I think, you know, that's my hope for the future. I don't know if you want to each divvy up different parts of the question, or
Sure. Dr. Moore?
So my hope for the future, and I appreciate all your comments on metrics, I think they're very accurate, is that, and I think we're seeing it already with Dr. Niren's porcine antimicrobial resistance tool that he's rolled out to his clients, is that we'll have a collaboration between both private and public sector on looking at and defining meaningful outcome metrics in the animal agriculture industry, and that's what it's going to, because we're such a diverse group with such diverse things we have to measure, that'll be a collaborative process between both the public and private. I know that there's a lot of production systems now that have gone to great lengths to assure they only use antibiotics when they're necessary. And they have very good records on what they are doing, but they are still proprietary information for those organizations that we have. And at some point, we'll have to have some type of public involvement or public collaboration. I think they're willing to do that to address the issue, but it's going to have to be in certain terms with certain levels of granularity in that type of data.
I agree with what's been said. Maybe to add to that, my vision for the future involves having a stronger connection between our interventions and the intended outcomes. Right now, we're doing a lot of things with the hope that they will ultimately impact on antimicrobial resistance. We're depending on metrics that are really process metrics, reducing antimicrobial use or increasing appropriateness, but it's really hard to know exactly what we're doing, connects to what outcome. And my vision for the future involves having that knowledge where we have truly evidence-based interventions that we know are actually impactful, and that those that have not proved to be impactful, we will have abandoned and leave those in the truthiness category.
Yeah.
Question from the audience.
I definitely want to recognize you, Dr. Eisenstein, for your mea culpa early on about a paper that frankly was very, very injurious to animal agriculture. And so that takes a tremendous amount of courage, and I want to thank you for those comments. As we wrap up this symposium, this is the 6th of its type. In the last 5 years, I think really the strength of this symposium has been our ability to bring people together from across the health disciplines, to talk to one another and to share insights. And I hope for the physicians in the room who are here for the first time that you'll come back regularly, because it's really this sort of talk across the disciplines that's really been so insightful for many of us. I just want to say, I want to recognize the fact that this symposium was first created by an organization of animal agriculture. And the fact that we're here is due to animal agriculture's insight that it's so important to do these kinds of interactions. And I want to ask you, since you brought this up, how do we in animal agriculture and we in veterinary medicine, how do we bring this kind of insight, our background, to share with the human physician community? Are there similar kinds of fora that we can attend in the human community so that we can be more active in providing this perspective?
I'll start with that. There are 3 major meetings, I would say, every year that include microbiologists, human infectious disease experts, and European experts in both fields. They are respectively the ASM annual meeting that has now been combined with the old ICAC, which was the antibiotic discovery group, basically. And it meets once a year. It's now in the spring, called Microbe. The last meeting was back in the spring, Microbe 2016. The upcoming one, 2017, will be in the spring. I believe it's in New Orleans. A lot of great thought leaders there, including leadership from the American Society for Microbiology, and you want to figure out a way to get very closely connected with them. The second is the Infectious Disease Society of America, which just completed its annual meeting called ID Week. I just got back from New Orleans about 4 days ago. A week-long meeting. It's a combined meeting of the experts in adult infectious disease, pediatric infectious disease, AIDS-related research, and the Epidemiology Society, SHEA. And this group comes together. There were multiple talks, as you may have heard earlier, on antimicrobial stewardship. Not once did I hear mention of animal-related antimicrobial use. The closest that I heard about sewage and that sort of contamination was the talk that I described earlier from Dr. Gupta. But that's, to me, another great opportunity. And last but not least, because it has an even, in some ways, broader global aspect, is the ECMID meeting held in Europe. And that also is every spring. The last one came back from, I'm trying to remember, I think it was in Amsterdam, a week-long meeting. The nice aspect about ECMID is they bring both practitioners in infectious disease and fundamental microbiologists together. And it's a terrific meeting. And again, I saw no representation from any of the folks here. Now, I may be incorrect. Well, let me show of hands. Did any of you in the audience attend any one of those 3 meetings? I went to all 3. Okay, so we do have some. But you're in human health, of course, Steve, and I don't, you're the sewage guy. Great, great. We need more of that sort of discussion at those meetings because we're not educated enough in that. And I saw another hand. Yeah, and you are.
I have my own company.
Oh, okay. Okay, good. So there is some, but you know, the vast majority of you were not interacting. So I would suggest that be a way to get going. The other thing I mentioned earlier, a lot of great talks. You have the opportunity to put together maybe a symposium, to put in clinical infectious disease. They publish symposia. And that gets to essentially all practicing infectious disease experts in the United States. And for every one of these other conferences, you can write to the program director and ask that there be a session devoted to the topic of your interest. And you get to then choose your speakers. Now, you can't guarantee that you'll get an enormous audience, but I think you would get a lot of interest. We can get the cross-talking to begin. My colleagues here, you want to make additional points about any of that?
I would add to that your public health colleagues can help bridge that gap as well. In terms of meetings, the American Public Health Association meeting was this week. Much smaller organization, but very impactful is Association of State and Territorial Health Officials and their affiliate organizations. Again, much smaller group, but the state health officials, the directors of the health departments, can be very influential. And most, if not all, states have a state public health veterinarian, or at least a veterinarian epidemiologist on their staff who can help to bridge that gap and reach out to the healthcare community.
Other thoughts? I've got another question from the audience. Does the United States need a champion to coordinate antimicrobial actions at the federal level? We've heard about all these different independent groups. Is that going to help or is it going to hurt? Maybe we should get Steve up, who used to work at the CDC. You want to make a comment about that? All right, the panel.
Well, I'd start out on that. I think that's absolutely true, especially in animal ag. There's a lot of associations that are all moving in the same direction. NIAA has been doing it for the last 6 years. If there was some type of, whether it be a champion or clearinghouse, in general, that where all the information could go through, we wouldn't have to duplicate efforts. You heard before that where we spend, what was your, Scott, on the statement about they spend $1 billion to make 1 point, and we spend $1 to make 1 billion points, is what we had. And that's kind of where ag has been facing its, well, not demise, but turmoil in the realm of the consumer and public opinion in a lot of ways. And having that clearinghouse or that where we could multiply our efforts would be very beneficial.
I guess I would say sometimes it's hard to have one champion. So, I think if we could have multiple champions moving in the same direction, to me, that would be ideal. It's been interesting participating in some of these conversations as a result of the UN meeting. There's been this interesting tension between should we have one entity overseeing and trying to coordinate all the activity that's happening both in the US and globally, or should we agree to share information and sort of focus in the areas that are most important to us. And I think it's an interesting tension, but I do feel like probably the more realistic is to have multiple champions working in the same direction.
I would agree with Kathy about multiple champions. There are many of our messages that are common, but in some ways we're in different places. For example, on the human health side, I think most of those involved in human health have come to the conclusion that we are overprescribing, overusing, in some cases misusing antimicrobials, and are trying to convince the public that they don't need an antibiotic for every cold or flu. Where you all is in animal agriculture is a different place. In many cases, you're trying to convince the public that you need to at least have some antibiotics to treat sick animals, and that antibiotic-free, needs to have a reasonable definition. And so those are, we're going in the same direction, but we've got some somewhat different challenges. So we may need multiple champions who are to stay clear on those messages.
Yet we did hear an interesting discussion at the prior panel about how difficult it is to bridge from one government organization to the other because of the silo effects. And we certainly see that in our big, corporations as well, Merck, et cetera. So these are human challenges, but I think given the overall need here, we need to figure out a way to overcome that. There was a comment in the back.
Yes, I'd like to, as a producer and a veterinarian, I'd like to express my appreciation to the speakers because I think they've been candid and there's not been finger pointing, and I think that's so important for us, myself as a veterinarian and as a cattle producer, to say, yeah, we've got a job to do on our own side here to judiciously use antimicrobials. They're very important to the health of the livestock that are entrusted to us for care, and we have a welfare obligation to these animals, and healthy animals are more productive, and also to recognize that the physicians have also stepped forward, and they're not pointing the finger toward us in animal agriculture. And so when somebody talks about animal resistance, I don't say that, well, those darn physicians are using antibiotics for ear infections and bronchitis. So I think that's a great step forward to talk to each other and to discuss these problems candidly across groups and realize that working together in a One Health fashion is going to accomplish a lot more than each existing out here on our own island. And also, to defend animal agriculture, as I mentioned, we need antibiotics to treat sick animals, prevention, control, and treatment. I don't know of any veterinarian or any producer at this point in time who says, oh man, I'm really going to miss these feed-grade antibiotics that had that production claim on the label. I think we recognize that that was a mistake. And it goes back many, many years. Some of those products got that label 50 years ago. So I think that's a step forward on the animal production side. But, another word that's passed around a lot in the animal agriculture world today is sustainability. And we have world sustainability groups and national sustainability groups. But health and judicious use of antibiotics is an important part of that, because if we in the beef cattle business have a cow that has a calf and weans it at 7 months of age, it goes into the feedlot as something on the short side of year of age and dies 30 days before it goes to market. We've wasted the grass that the cow ate during pregnancy, the grass that the calf ate, the water that they drank, and the feed that we offered that animal during the feeding period. So we wasted that, and to me that's very unsustainable. So again, I appreciate the way you all have tied this together and looking at this at a One Health approach, and I think we've done a very good job today in bringing this to the forefront and looking for candid solutions to judicious use across all species, human, livestock, and so forth.
Thank you. And with that, I think the conference can conclude. I'll just leave you with my last thought, that to make peace with spouses, we should be treating well both our mothers and our mothers-in-law.